The following is an Operation Podcast production.
And this is coming from someone who practiced as a physician. Yeah. If you're not having that meaningful connection, don't give up on medicine. There's still so many people who don't understand the importance of having health insurance, having a primary care provider who knows you. And so to try to not only prevent illness, but to keep you well. And also, if you run into a crisis or catastrophe, you know exactly who you can call. But even before getting there, how do you navigate the benefit space? Whether you're employed or unemployed, whether you're high income or low income. And so there's certainly a need for greater literacy. But what's critically important is that there's an option for everyone, and everyone can have an affordable option too. For your listeners who are getting the labs, who are doing the exercise, who have the Fitbit, who have the Apple Watch, and they're doing all the right things to try to stay fit, yes, and also have insurance and have a healthcare provider who knows you and can work with you and walk with you to even optimize even further. You have access to so many different things, including sometimes even low to no cost medication. I'm Dr. Daryl Gray II, and this is Everforward Radio.
Dr. 50 Shades of Gray in the house. How many times do you get that? I'm sure I'm a first time ever.
Not as often as I used to. Let's just put it that way.
Dr. Daryl Gray, it's so good to have you here. Thanks for coming in today, man.
Thank you for having me.
This is going to be a very exciting for me personally and professionally. I feel like I'm kind of blending a lot of worlds here, but also just such an important, for lack of a better term, campaign. Public health campaign wrapped up in a podcast, because this does take me back to a lot of my work as a health coach, as a wellness director, working one-on-one with people. And even I'm thinking back to so many internships I had in undergrad and grad school in employee wellness and literal public health campaigns. And I'm just so flabbergasted of the struggles that I had 7+ years ago, kind of getting started and literally trying to lead people to water of, hey, here are these benefits that you're paying for. Hey, here's what you have access to in your community. Or here are just other incentives that you can utilize to maximize your health, optimize your health, or maybe treat chronic illness, disease, injury, all that. And it was such a struggle then. And so for me now to kind of sit down with you to unpack this conversation, because it has to be had.
Has to.
Have we not learned our lesson?
I'll tell you, I wish I could clone that former and current you, because we need certainly more ambassadors who are willing to go out there and share this information. Because unfortunately, to your question, there's still so much progress to be made. I mean, whether I'm looking within my family or thinking about former patients I had in practice or going out into the community and talking with folks, there's still so many people who don't understand the importance of, having health insurance, having a primary care provider who knows you. And so to try to not only prevent illness, but to keep you well. And also, if you run into a crisis or catastrophe, you know exactly who you can call. But even before getting there, how do you navigate the benefit space? How do you, whether you're employed or unemployed, whether you're high income or low income, what's the importance of that? And so there certainly is a need for greater literacy around these things.
Can you walk us through a little bit of your past training experience to kind of help the audience member know that this is someone that walks the talk?
Oh, thanks for that. I'll tell you, I had the benefit of really having a spark lit in me by my father. It's funny. Before this show, we talked about you talked about your father, and I get to share a little bit about mine. My dad practiced internal medicine in inner city Baltimore. And as a young boy, I got to go with him into the office, into the hospital, and to see how he was able to really help people live more empowered lives, well lives, how he helped to manage illness, but also helped to keep people well. And the rapport he built with people, whether they were well, sick, whether they were in a political atmosphere, whether they were served in clergy or served in grocery stores. I mean, he treated people from all walks of life. And to see the impact that he was able to have really lit a fire in me. And so I kind of pursued a traditional course to get into a medical career. So college and then med school. I did med school in D.C. at Howard University College of Medicine after leaving Morehouse College, and then did an internal medicine residency at Duke. Subsequently went to St. Louis, where I went to Washington University to do a gastroenterology fellowship, so a gut health doc. And then at the end of that training, I realized, to go back to one of your opening comments around public health and the importance of public health campaigns, I realized that I had a kind of deficiency that I wanted to fill to better connect with patients and people in communities, but also to enact change, not just on a one-on-one patient encounter, but something that could impact communities and populations more on a national level. And so I pursued a fellowship. It's called the Commonwealth Fellowship in Minority Health Policy at Harvard. And after that, I went to Ohio State. I was there for about 7 years practicing in medicine. So I practiced, I saw patients in clinic. I did procedures like colonoscopies and upper endoscopies. I did NIH-funded research where I was in the community and helping to co-design studies with community members that would improve health. And we did, whether it was cardiovascular disease or things about colon cancer, we did quite a bit. And so on that journey, again, I recognized the importance of population health, public health, and that led me into the health insurance industry, initially as Chief Health Equity Officer for Elevance Health. And now I get to serve in my home state as President and CEO of WellPoint, Maryland, which is an Anthem Blue Cross Blue Shield affiliate, and ensuring that our 300,000+ members who are part of WellPoint Medicaid in Maryland can achieve their optimal level of health possible. And so getting people connected to the benefits and the programs, like you mentioned earlier, it's purpose-driven work, it's mission-driven work, and it's personal.
Getting people connected to programs, to incentives, to insurance.
Yes.
I used to have, there's this phrase, right? You can only lead a horse to water, right? And in my experience, I realized it's not only do I have to lead them to water, I have to convince them how thirsty they are. Because you're right in front of the water source. Right, hey, I'm your guy, I'm your girl, here's the program, here's the offer, here's the free, here's the low cost, here's the just fill out this form, and so many of your needs are going to be made better. But even then, it was the struggle. And it takes me back to anybody else having an internship in the space, I'm sure can relate. I did one internship in a hospital here in Virginia, or down in Virginia. And I was literally in the hospital, going to people's offices in the stairwell, handing out, little incentives and flyers and things. And I'm in a hospital. I'm in the belly of the beast, handing out, you don't even have to come to me. I'm going to you for free information and access to, it was employee benefits and employee health care and employee insurance incentives. And even then it was just like, it's like I had the plague or something. What is it about access to information, even access to free information resources, that people still are hesitant to grasp, do you think?
I think there's multiple things at play. I think one is, you brought them to water, you're convincing them how thirsty they are, and then sometimes you just have to show them how to drink. And I think,
he went further. I like it.
It's navigating the benefit space can be very confusing. And so people, even if they're well-meaning people such as yourself, going and saying, hey, this is what you have access to, this is how you can tap into it. People, it's just a long history of, hey, it's confusing. Yeah, I might have insurance, but what are my benefits? What do I have to pay for? What don't I have to pay for? Is this the best insurance plan for me? Because I have so many options. So I think it can be confusing. And so I think that's one thing. I think the other thing is, particularly for those who are uninsured, they might be confused that, hey, yes, you're coming to talk to me, but I can't afford that. I'm not employed, so I don't believe I can afford it. Not knowing that there are options for people who are unemployed or have no to low income. And I think there's, another camp that say, I'm healthy. Hey, regardless, I might have I might have employer-sponsored insurance. I might not have any insurance. I'm healthy. Look,
I don't want to contribute to sick care. I'm good.
Exactly. I'm good. Hey, look, I'm eating my broccoli. I'm running miles a day. I'm good.
in the stairwell, bro. I'm taking the steps, not the elevator. Go find somebody else.
I got my Fitbit. I got my Apple Watch. But not knowing that it's so critically important to be plugged in. Because the last thing, like I said, you don't want to be in crisis trying to figure things out. You want to have things figured out before you head into crisis. And that's where understanding your benefits, having a healthcare provider who knows you and can get you connected to the different levels of care or the benefits or to the kind of coordination of care that you need is so critically important. I mean, what was the main dialogue through the pandemic, and even as we have come out of the pandemic, particularly around mental health. I mean, it can be so incredibly difficult to find a mental health provider if you're not already plugged into, a system and care providers who know and understand your needs. So that's just one example.
So before we even get into, programs, benefits, insurance, does it start with provider? Do we need to have access to and understand the importance that a primary care provider can actually have for us? Because I think that's where a lot of people have the most aversion is you had a bad experience with a provider. I can't afford it. It's too far. Access for whatever reason. It's not going to take my coverage. I don't have any coverage. How can we navigate those barriers to entry for a provider?
Yeah, I think that's critically important. And that's also where health insurance can play a huge role. I'll give you an example. So we have, through Anthem Blue Cross Blue Shield, have what's called myhealthbenefitfinder.com. And that's how, just easy. You can type it on your phone. You can go to your computer, laptop, type that in. You're able to add some information. Hey, I'm employed. Hey, I'm not employed. Hey, I make a certain income, etc., and find out what kind of insurance you would qualify for. For some, they may qualify for Medicaid, as an example, where they have low to no cost for being able to see a provider or have these other benefits and access to programs. That's just one example.
Which is already pretty mind-blowing because, and this might be kind of my own ignorance or misunderstanding, is that you think, you hear Medicare, Medicaid, you kind of think one thing. You think like you have to be in dire straits or a certain, economic status or, some of those things definitely are true.
Correct.
But I'm hearing that's not necessarily a blanket case.
Exactly. So as an example, yes, traditionally, when people think of Medicaid, they think of low income, they think of moms and children and those living with disabilities. When people think of Medicare, they think of 65 years of age or older, or things like end-stage renal disease.
Right, like I'm not retired, I can't get Medicare or Medicaid.
Exactly. But what's critically important is that there's an option for everyone. Everyone has an option for insurance, and everyone can have an affordable option too. And so that's what I highly recommend, that website, easy to find, around what are the affordable options for you and what you might qualify for. And I think that's, going back to your question, I think that's one critical first step, because even through that insurer that you get connected with, you can get connected to the doctor that you want.
Very true.
And to your point, I think bad experiences can be really triggering for people, or may be very off-putting for people reaccessing healthcare when they need it. But I always encourage people, find the doctor that is kind of sensitive to you, that listens to you, that believes you. And it's okay to have a second or a third opinion. And this is coming from someone who practiced as a physician. I would encourage people to do the same. I do the same in my family. If you're not having that meaningful connection, don't give up on medicine. Don't give up on seeing a physician or a nurse practitioner or a physician assistant. Find another one, but stay connected.
Remind us, please, the difference between Medicare and Medicaid.
So Medicaid is a both federally and state-funded program. It's like a public health insurance program. It's largely catered towards those who are low income. So based on their income, they may qualify. In Maryland, we also have access for those who are, particularly moms, new moms who are undocumented, can also get access in Maryland to Medicaid. So moms, children, those living with disabilities, and low income.
So is Medicare more for those on disability?
It can be. Particularly, I gave an example of end-stage renal disease, but typically people age into Medicare, so they're 65 plus.
Okay. My audience knows my story of I was sharing with you my career-ending injuries in the military, and I was in such a weird gray area of technically still on active duty, but I was pulled from duty, and I was in a medical hold unit for about a year and a half. And I was basically just in hold to go through surgeries, rehabilitation, and transition out back into civilian life. And due to the nature of that status and my physical condition and disability at the time, I actually was able to get Medicaid to supplement outside care. I was able to use Medicaid. I believe, total honesty, I believe I also got I think it was like a few $100. It was like a small monthly allowance plus coverage for outside care. And what I used that for was really different rehabilitation and therapy needs that I was not getting from the doctor, or my active duty assigned doctor, orthopedic surgeon, rehabilitation specialist was like, hey, I really think you could benefit from this stuff. We don't offer it. You can't get it on active duty. So I was able to kind of use that to go off base to get other treatments that honestly, I really do feel at the time gave me a lot of need, a lot of therapy, a lot of rehabilitation.
That's fantastic,
but definitely opened me up to things that I still use today.
You
know, like acupressure, acupuncture, massage therapy, a lot of different things.
And a couple of things you said that really I think the audience needs to kind of double back on and rewind is you were connected to an orthopedic surgeon who then gave you the recommendation about, hey, consider these other options, but you were connected. And one of the things that helped you to get connected is that you had access through your insurance to these different things.
Right, yeah.
And through that, what you also said was, hey, I got a stipend, I got these other benefits that help me to recover and help me to get back on my feet, you know, literally and figuratively.
Literally.
So,
Twice.
Yeah.
Hey guys, quick break from the conversation today with Dr. Gray to remind you about how important it is to, if nothing else, just become more aware to the potential benefits coming your way. But certainly, if seeking health insurance is in your budget, in your lifestyle, in your plan, there is a plan for you. There is a plan for any budget. And if you head to myhealthbenefitfinder.com, they're going to walk you through for free how to find the right coverage at the right price for you, no matter what you have going on in your life. Thank you so much for tuning in and ever forward. A lot of times we have benefits, right? Whether it's through our provider or we get insurance another way, and we think that's it.
Yeah.
And that was me. I was like, I'm an active duty soldier. I have this form of coverage. That's it. But that's not necessarily true. So can you walk us through maybe some misconceptions people have about, I have this coverage. That's all that I can have access to. But is it true that by having access to or having coverage in one capacity opens you up to other coverage as well?
Yeah. So, I mean, you gave a really great example that I'll leverage here in that you had insurance through the military, your time, but you also needed supplemental insurance.
Right.
And so people, depending on their needs, their situation, they may need a supplemental insurance. Most times for those, I'll give the example of where I am through our members at WellPoint in Maryland. They might not need supplemental insurance. If they're on Medicaid and they have access to all the programs and all the benefits that they need to successfully traverse and achieve the health outcomes that they want, they may not need any extra programs. But there is the option, as you think of employer-sponsored coverages and things like that, there are supplemental options that people can explore for their benefits. But the point that you made, I want to go back to and really emphasize is that it's so important that people understand what are the benefits. Don't stop at just getting the insurance card in the mail. Yes, I got my card. I can access it when I need it. You know, take the next step and say, okay, well, let's dig deeper. Okay, what is actually involved? Do I have, if I'm a mom, do I have access to lactation services? If I have high blood pressure and I know I need to be taking high blood pressure medicines, what are the pharmacy costs associated with this? Can I get free meds depending on what meds are taking and what pharmacies align with that? So most
people don't think about free.
Yeah, you have access to so many different things, including sometimes even low to no cost medication, depending on what the formulary is or what you need from your pharmacy. So that's why it's so critically important that people don't just stop at the card or, you can now download it on your phone. So don't just stop at that, but explore what the benefits are. Matter of fact, if you go to, let's say you go to a healthcare provider now, you'll get something in the mail from your insurance that says EOB, explanation of benefits.
Yeah.
And so it's, take the time when you get something in the mail, even if you don't owe anything based on what your clinical visit is, to review that. Look at that paper, flip it over, just see what your benefits include, because that's so important. Yeah.
When we are ready to go shopping for insurance or just, coverage to kind of just open up our awareness, should we be thinking symptoms first? Should we be thinking based on my age, or should we be kind of looking at benefits first? What is the best approach when initially looking for coverage?
Yeah, I think start with, hey, what is affordable? Because the last thing we want is someone to not have access or not have insurance because they feel like it's not affordable. The benefits that are offered through this plan, does that align with what I need? Maybe I have poor vision and I know I'm going to need glasses every so often. Are those included in the benefits? Or maybe I don't have access to transportation, but this insurer provides a value-added benefit that includes maybe an Uber voucher, just as an example. So
that's a thing?
That's the thing.
Wow.
That's the thing. So, looking through what are the benefits after I see, oh, this plan can align with something that I can afford, or maybe it's no cost at all. And then what are the benefits? And are those things that I will leverage? Is it best for me? And then also thinking, okay, well, I have this insurance, I have these benefits. Do they have providers that are in my network? Because convenience is incredibly important. I think most people would like to go to a healthcare provider that's close to them, whether it's close to work or close to home, as opposed to driving hours to get to a healthcare provider or a specialist. So looking and seeing, making sure that your provider is in the network is also incredibly important. So those are some steps I would recommend. Yeah.
That's incredible. I had no idea that was the thing, but I had no idea that, it's great to hear that the healthcare system, because I think for a lot of different reasons, people have a lot of different hesitations to getting into the healthcare system or coming back to it. Poor experience, what they hear or see on social media or mass media, and very rightfully so.
Yes.
But I'm hearing that there's been a real transformation in really reducing, if not eliminating, damn near all or most common barriers to entry for people to finally get the care that they need.
Yes, and two, absolutely yes to that, full stop, period. Yeah. But I would say also too, to your point around stigma around the healthcare system, there has been one, and it's been well earned. One of an environment where people may not feel heard, or people may not trust certain things based on bad experiences.
Or things getting made worse because of.
Exactly. Yeah. And, stigma or stereotype around healthcare that it's only a repair shop, but it's also preventive care. And so that's so incredibly important. Yes, you may be eating broccoli, you may be running your miles a day, but we also want to prevent something that could happen in the future that running or eating broccoli may not prevent. And so it's so important to get it plugged in with and have a relationship with a healthcare provider who listens to you, who understands you, one you can trust, and one that you can call, whether it's a crisis or not, just trying to maintain the wellness that you have.
Yeah, knowing where to go, when, and why is the core of any readiness plan.
Yes.
And I think a lot of people, if you take a real pause right now, an honest inventory of, you probably have that in your life in other areas, right? When shit hits the fan at work, I've got my mentor, I've got my boss, my colleague. When, life gets crazy, I go to my mom or I go to my best friend. Think about your actual health. Do you have that same kind of plan? I think most people don't. But why do you have all the other plans in other areas of your life? Do you not take your health as serious?
Right. And what's funny, and you said this, there can be an over-reliance on social media. There can be an over-reliance on Dr. Google, to provide all the answers to the symptoms that you're having. But that can be you can go to Dr. Google, insert your symptoms, and be the most ominous diagnosis you can think of. But why not go to someone who is trained and spent their career trying to understand how they can prevent this, or how they can treat this, or how they can better understand and guide you to that? And there may be some people who say, well, they only want to prescribe me medicine, or they only want to get me in for surgery.
Fair, yeah.
Or and again, that's based on experience, and some of that is well earned, right? But that's not all people. And so I highly encourage people to, again, find that person that listens to you, that understands, that's willing to kind of go the extra mile and tailoring the care to you, personalized care.
I think I'm going to make an assumption here. Yeah. Everyone listening, watching, please let me know otherwise. But, I really feel like my audience, barring any acute injury or illness aside, I really feel like my audience, and myself included, we pride ourselves and we strive for daily optimization. We strive for, continuous learning so that we can, do body scans, use wearables. We can, have that quantitative and qualitative feedback in units of measure, even, as far as getting labs or one-off things here and there. So really make the case for us here. Why should someone who is, again, air quote here, healthy, why should we really even consider investing in or spending our time before we even spend our dollars, spend our time into considering insurance?
Yeah. I'll share a couple of personal examples, actually. So this is years ago. Healthy. Had insurance, thankfully, and you'll understand why when I tell you in a minute.
This is you personally.
This is me. This is me personally. This is in medical school training. I had a injury. I was moving, lifting some heavy furniture, and it felt something weird in my back. Felt something pop. I didn't think anything of it because I could still walk. I was still doing whatever I needed to do that day, but the pain increased. It increased over time. One day it kind of faded, so I just ignored it. I would take, Tylenol, ibuprofen when I got it every now and then. It kind of residency training would come and go, fellowship training come and go. Fast forward just a couple of more years, and it became debilitating. I'm literally seeing patients in clinic hunched over because of my back.
This is years later.
This is years later. I'm doing same injury, but just kind of progressed over time. There was one day I was doing procedures, colonoscopies, literally had to hunch over doing a colonoscopy the entire day. I got home and literally could not walk in the house. I had to crawl, and turned out I just had a severely herniated lumbar disc, and ultimately had to have surgery. Now, if I had not had insurance, that would have broken my family and I. To pay for that orthopedic spine surgery.
You're probably talking, what, hundreds of thousands of dollars?
I mean, yes, at a minimum.
Yeah.
And fortunately, that was not the case. Now, again, I was the person, I'm exercising, I'm eating right, thankfully, and that's largely because of my wife. But, catastrophe happened, right? And this was something that helped me. I'll also say, I was one, even as a person who learned medicine, it was practicing medicine, going through training in medicine where, and I'm exercising, doing the things, and I found out I had elevated blood pressure.
No way.
And I had, and this is someone who, again, exercise, I'm thin, all the things, and someone might look on the outside and say, he looks pretty healthy. No, I had elevated blood pressure.
Let me see those labs.
Yeah, exactly.
Let me see those labs.
Yeah. And so that's where also insurance helped me personally, because again, I got a doctor who listened to me. Hey, what can I do, doc? Because I don't necessarily want to be on medicine. Let's see what I can do, whether it's increasing exercise, making tweaks to the diet first before getting in medicine. Ultimately had to be on a little bit of medicine, was able to get off of it for a period of time. And so that's important. And I think, yes, continue to do those things. For your listeners who are getting the labs, who are doing the exercise, who have the Fitbit, who have the Apple Watch, and they're doing all the right things to try to stay fit, yes, and also have insurance and have a healthcare provider who knows you and can work with you and walk with you to even optimize even further.
I'm a small business owner, and back in LA, do the podcast, and I've got some podcast studios. And getting some new ones open, I had to go through insurance, renter's insurance, business insurance, and they started going through explanation of benefits.
Yep.
Oh, so how much coverage do you want for injury, loss of wages? I said, can you explain that more? What do you mean? So, if you're on the job site in the building and you trip and fall or something happens and you can't work, what is your daily loss of wages potential? And that immediately made me go back to opening up the most recent studio, or second to last recent studio. Man, I blew out my back bending over to paint a wall. I deadlift almost 500 pounds. You asked me to pick up a paint roller. I was out for like 2 weeks.
Oh my gosh.
I couldn't move. I was on the floor. And in that moment, I flashed back in this explanation of benefits.
Yeah.
But I go, I need to make sure I have this covered in just like other insurance. Can you talk to us more about that? I think this is another unique layer to insurance that people might not think about.
Yeah.
What happens when maybe you have an injury or a freak illness takes you out of your job, but you're losing money. You're not able to earn money. Are there situations like that can help people?
Yeah, well, I'll tell you, there are many people for whom any medical problem can be an instant pathway to large amounts of medical debt, particularly for those who are uninsured. I mean, you have one catastrophe and now you're prioritizing whether I have to pay the hospital or the healthcare provider back or pay the mortgage or pay the light bill. And there's far too many people across the nation who are in that situation, and largely because they didn't have insurance or they had insurance, or just not enough to help with that situation. But it is so important that people think about, well, what kind of insurance do I need? What situations do I want to be covered for? What do I have access through, maybe through the employer, or if I'm unemployed, not having employment, what do I have access to? And do I need something supplemental for situations that could be catastrophic?
What about using this as a negotiation chip in a job?
Yeah.
Maybe we're comfortable with the salary, or it comes down to, hey, we can give you a little bit more money, but we're going to lose some health benefits.
Yep.
Walk us through maybe a scenario where kind of leveraging negotiation with your employer for healthcare coverage is actually to your advantage.
Well, I'll give you an example. So if someone is part-time, they may not qualify automatically for the full-time benefits,
which is
could
true for
include
most people, right? Unless you're full-time, you don't get benefits.
Or particularly if someone is a small business owner and you come in as an employee, and they may not, based on how many employees they have, they might not have to provide you. They might not be obligated to provide you insurance benefits or health benefits. And so you coming in as an employee, you may want to negotiate. Now, the person that is employing in a position to employ you may say, okay, well, I may need to bring down the salary a little bit to be able to offer you those things. But that's where negotiation can take place. Hey, I know I'm going to need health benefits. Maybe the person is coming in fit, but concerned about something happening, or wanting to get plugged in and making sure that they do have a healthcare provider, accessing primary care, specialty care, et cetera. Or maybe someone is coming in with a chronic condition and knowing that they're going to need care and those kind of things. Or maybe it's not just for them, but sometimes when you sign up for insurance, you can also sign your family up for insurance.
Right, yeah.
So understanding that, and yes, that can be a point of negotiation walking in with the employer. Yeah.
Now, can I just at any time that I choose, learn what's open to me and just sign up for coverage, sign up for insurance, or are there open seasons? How does this work?
Good question. It also depends on what type of insurance you need. There's always an annual enrollment period. What's called open enrollment. As we think about employer-sponsored insurance, we think about Medicare, commercially sponsored insurance. That open enrollment is usually in the fall. So there's an annual on a rolling basis for Medicaid. Now, in the same way, though, they also need to renew. So just because you signed up one year, you'll need to renew the next year. And, I'll say, if you'll allow me, as we were going through the pandemic, particularly the last, 3 years or so, the kind of what was usually a routine reevaluation of people's eligibility was kind of relaxed amidst the height of the pandemic. And so people were allowed to stay on the Medicaid insurance without having their eligibility reevaluated. That was important because some people, they may have gotten a new job that they now earned more income and didn't qualify for Medicaid. But what we learned when we came through the period of what's called redeterminations, which kind of started last May and just really ended in Maryland, it just ended April 30th, was they were reevaluating eligibility. So someone might have moved and they lost coverage. Someone might have gotten a higher earning job and they lost coverage. But many people, they just lost coverage because they did not renew. They did not take the time to renew their coverage, to fill out the paperwork, to do that. And so I say that to say, to go back to your question, it depends on where people fall as far as what they have access to, what they can afford, what opportunities they have, and what they need from a health insurance standpoint.
That brings up a good point about how oftentimes, and I think this is where a lot of people get stuck, but honestly they weigh their options and choose to, air quote here, stay stuck because, I heard you say they moved, maybe so they got a better apartment, moved to a better part of town, they got a higher paying job. So they're doing things to level up their life.
Yes.
Dare I even say level up their health, because with that comes a certain level of affluency that you can now take better
networks
care of yourself.
too,
Right.
social networks and other types of networks that influence your health.
But because of that, we're losing access to care. Or because of that, we're losing maybe the bandwidth to go back to making sure that our access to care is taken care of. So how do we best weigh those options? How, as a provider, and someone who helps people get the coverage they need. Is there a litmus test? How do we really weigh which option is best for me in terms of my health care, and in many people's cases, their families?
Yeah, that's such a critically important point, because let's be real, people have to prioritize. And so many times I would see people in the clinic, and I'd ask questions to better understand what led to this diagnosis, what led to you coming in with this disease, and really trying to uncover what were the decisions that were made, what are the lifestyle choices, what are the circumstances people would find themselves in that would influence them getting this disease or having this certain lifestyle. And I think what I was able to uncover from that is, people make decisions based on what they can prioritize. So for some, their priority may be, look, I'm working 3 jobs just to keep the lights on, try to get my kids in school. I haven't had time to go to a doctor during the week because I'm working all the time. And so, for them, I would have to say, look, I'm glad you're here now. No, we also have weekend hours, so don't wait for a catastrophe like this. Try to ensure you're plugged in so that you can see after hours care or see someone on the weekend. Those options are available for you. So I think it's taking the time to understand what you have access to, regardless of the competing priorities of your life. It's funny, I'll tell you, just like when I was sharing the story earlier about me and having elevated blood pressure. And I was talking to my wife about different decisions or what I could do or what I couldn't do, what I didn't feel I could do because I was prioritizing other things. She said, pay now or pay later. Pay now or pay later. Yeah. And it's true. Your community will appreciate, yes, they're trying to optimize, whether it's through nutrition, right? Trying to optimize nutrition, trying to optimize exercise, and all for good reason, because you want to, put yourself in a position to lead a long and healthy life. But part of also having insurance, part of getting plugged into a healthcare provider is that's further optimization. And yes, some insurance may require you to pay out of pocket. You may have a copay when you go see your healthcare provider. And when I would have people in the office and they'd be kind of discussing those things with me, because it's very real. And I would definitely empathize with that. I also wanted to drive home to them is, look, I would be happiest if you don't have to come see me again because you're not experiencing this problem or this symptom again. Yes, I would love to see you outside at Trader Joe's or in the street or in the community event, but I don't necessarily want to have to see you in the hospital or in my office for this reason. And so it's kind of like pay now or pay later. Try to make these lifestyle changes now so you won't be paying for it in a different way later in the hospital.
I remember when I was running my health clinic, literally just down the road here. And so I worked in concierge medicine. So people are paying a membership to come see me and have certain access to me, as a health coach and certain programs and access to care. But they also were getting a benefit that my understanding was open to a lot of people, even just with regular primary care providers. And that was HSA and FSA reimbursement. So I literally had an exercise prescription pad on my desk after we would run a personal training session. We would do a body composition analysis, a VO2 max test, and I would write down, what we did, check the box, sign my name, and they would submit that to their insurance provider. At that time, I believe it was up to $275 per session, and they were allotted 1 session per quarter. So they would get that reimbursement back into the HSA, FSA. My point here I'm trying to make is I think this is kind of good news for the people making an argument of, I'm already taking care of myself. I'm doing all these things. A lot of what you're doing in already taking care of yourself, you can get reimbursed or even get credits too. And that was 7-8 years ago. What is going on now in the world of insurance for HSA, FSA, or are we getting gym memberships? Are we getting wellness? Are we getting all these other things that might have prevented us from getting insurance before?
Oh man, that's absolutely right. I'm so glad you brought that up and that's why I was telling people, go to myhealthbenefitfinder.com because you can see what you may have access to that you didn't even know, or read. If you do have insurance, look into what you have access to, because to your point, you can get reimbursed depending on what insurance you have, whether it's a gym membership, whether it's fresh fruits and veggies box sent to your home. I mean, yes, like So I'll give you an example. So
through insurance?
Through insurance. So WellPoint, Maryland, our Maryland Medicaid program, we have value-added benefits, whether it's a gas card, gym membership. We've done healthy fruits and veggies to people's homes. We have healthy rewards where members can get rewards just for going to their healthcare provider. So we're so rich in benefits that people just. And sometimes we have to coach them. Hey, look, you have access to this, right? You go to your doctor, you can get this reward. Or we give baby supplies for new moms as an example. So these are value-added benefits that people have access to that some may not even know that that's an option for them. Yeah,
that's so good to hear.
Yeah.
All right, let's put our guy hats on here.
All right,
let's
do it.
What's up with guys not wanting to get healthcare? What's up with guys not wanting to go to the doctor? If it's such a struggle for us as a guy, just to admit that we have a problem or that, this injury is really something we need to get looked into. If it's that difficult for us just to take that step, is it realistic for us to think that we're actually going to look into our explanation of benefits or get health insurance?
Man, I love that you said that, because I'll tell you, the men that I would see in the clinic, it was largely because their wives or their spouses or their partners made them come in to get evaluated. And I think part of it is machismo. We think, oh, we're macho. We can take care of whatever ailment comes our way. We can beat it. Just with our thinking or with physical activity, we can beat it. Or we're like, hey, I got many other things to do that I can be doing with my time than going to see the doctor. And that's just, many of us were raised that way, or many of us were just conditioned to think that way. And I know you have listeners who are women as well, so thank you, ladies. Thank you, partners who are out there, spouses.
Any partner of anyone. Nudge your partner. Yeah,
nudge them. Have them to come in and see a healthcare provider. And I thank all those partners who have been doing that, because and I'll say this very seriously. It sounds joking, but you save lives by doing that. I can't tell you. I told you I trained as a gastroenterologist. So one of the main procedures that I would do are things like colonoscopy. Colonoscopy is a procedure where someone gets comfortably asleep, and then we use a long, flexible camera to look throughout the entire large intestine, or what's called the colon. And if we're doing it for screening, we're doing it to look for things like little polyps. They can look like little pencil erasers almost, or like little mushrooms, but that could lead to cancer. And so if we go in there, we see them, we remove them immediately.
Which, correct me if I'm wrong, is not colon cancer the number one killer of men?
Man, it's close to it. It's number 2. Yep. It's one of the most common causes of cancer-related deaths in the United States.
I think Peter Attia made this phrase catchy. Men will all die either from colon cancer or with colon cancer. But to not be the person dying from it starts with prevention.
It is largely preventable. So preventable. And so a lot of times I'd be in the pre-procedure bay talking with the person about, hey, this is what you're going to undergo. These are potential risks, et cetera. And they, many would say, I wouldn't be here if it wasn't for my wife or my partner or my spouse. But then when procedure's done, I go back in there. I'm in there with the wife, talking with the patient and the spouse or the partner about what I found. And I find a polyp, or I found even potentially what looked like an early stage cancer, or, for some, it was what appeared to be a late stage cancer. Regardless, people are kind of thankful that they were able to get the information to then take some action step that potentially saved their life.
Then you know what to do.
Yeah, exactly.
And it's not just, us two guys talking about it. Your professional experience, and pulled up some pretty wild stats to reinforce this, talking about men and insurance. And as men tend to be uninsured at a higher rate than women, stats show 14% of men being uninsured compared to 10% of women just in the U.S. alone. And then the younger we are, it's even kind of worse. Young men between the age of 18 and 24 are the most likely to take the risk of going without health coverage because, let's be honest, that's when...
Think you're invincible.
We're the strongest. We got the most testosterone.
Exactly.
We're transitioning to the next job or college or whatever. Also, men are significantly less likely than women to see a doctor or report symptoms to a healthcare provider. Only 60% of men go to the doctor for a yearly routine checkup, and 40% won't go until something is seriously wrong.
You served in the military, so this may very much resonate with you. in my training at Duke for internal medicine residency, we also trained right across the street from the main medical center at Veterans Hospital. And I absolutely love veterans. They would come in with they would hold on to their symptoms for months and even years. Something that may have been a little bump, they won't come in when it's a bump or it's just a little painful. No, they come in when it's spread across the entire arm, or the leg is almost coming off, or toes have fallen off, and so I say that to come back to your original point around, sometimes men will just ignore things. We think we can beat it, it'll go away, or I can manage with this pain, I can manage with this toe falling off.
If it's not killing me, then
exactly.
I'm not gonna die.
Exactly.
I'm fine.
Yeah, and that shouldn't be the case. Case. As the many wonderful veterans that I and a lot of friends and fellow physicians, nurse practitioners, PAs would see is, we're not the enemy. We want to help. We want to partner with you in your health journey and make you better.
So earlier you were kind of talking about, I forget if we hit record or not on this. So if my audience is like, no, we didn't talk about that, I apologize. But I think especially after getting on the other side of the pandemic now, we're aware of for the first time in a long time of mental health needs.
Oh man. Yeah.
And I'm curious, what can insurance provide? What are benefits are out there for people now in the mental health capacity that maybe weren't there before? Because I think that might have been a very unique barrier to entry for a lot of people.
Yeah, behavioral health, and I'll also add something that also kind of ramped up during the pandemic, substance use disorder.
Yes.
Those two things kind of being tied together.
Yeah.
There are so many programs through health insurers for those, whether you're facing anxiety, whether you're facing PTSD, whether you're facing addiction, trying to overcome a substance use disorder. There's access to mental health providers. There's access to addiction treatment. There's access to social support communities through insurers. And so that's just kind of an added benefit of being plugged in. Grief can hit us all, whether it's the loss of a family member, loss of a job, and that can manifest in different ways. For some, it may become more chronic and manifest as depression. For others, it may become chronic and manifest as general anxiety disorder. And so having a community, not just talking about healthcare providers, not just talking about mental health providers, but having a social support community to kind of surround you through these times is critically important. And that's where insurance can be also very beneficial.
What about kind of more in my world? And I definitely have a lot of listeners that are in the same boat. You're self-employed, or maybe you're in between jobs kind of thing. That's where I know a lot of coverage lacks for people. Or I can think back to my first year, 2 years even of being an entrepreneur. Man, I was not, again, very grateful. I was in a different bucket. I had my healthcare covered through the VA and TRICARE, but that's not the case for a lot of people. What's out there for self-employed?
Yeah, so there's so many options that at that time, depending on what year it was, may not have even been available to you that's available now. So there's certain subsidies that people have access to who may be self-employed, to have a level of income that might disqualify them from Medicaid, but not necessarily make another commercial plan affordable for them. So there's what's called the exchange, or this is a benefit that came from the Affordable Care Act, where people can get subsidies that would help to cover a lot of their insurance costs.
Really?
Yes. And
so the subsidy is basically free money?
Free money to go towards payment for insurance. And so, again, that's why, look, folks, if you haven't written down this website yet, myhealthbenefitfinder.com, go in there and
we'll
just
have it linked for you guys in the show notes. I got you. Yeah.
Exactly. But yes, there are subsidies for many people that they may not realize that their income qualifies them for. You don't necessarily have to be, in poverty to have access to insurance that is low to no cost. Yeah.
Okay, that's such a great point. Walk us through, because I can see how some people, that might be another barrier to entry, is there are people who need it more than me. Even though I technically qualify for, in God's honest truth, I could use, I feel some kind of way about taking any free care, free coverage, free money, because there are people out there that really, in my opinion, need it more than me.
What I would say was, by you accessing what's available to you, you are not taking it away from someone else. So those people who need it still have access to it. You are also just taking advantage of what's available to you and what you need. Particularly, you mentioned those who may be self-employed, and so you have a fixed income you need to work within as you're launching a business that you can't exceed, and so you're trying to think through what are those expenses that I can afford, what are those luxuries, but this is something where you may have access to a subsidy that would make this extremely affordable for you. Yeah.
So then what happens if we get into the coverage world?
Yeah.
We're insured, boom, great, congratulations. Yep. But you still don't have the best experience with a hospital system or a provider. What can you do to not fall out of the system again?
Oh, yeah. I think, and that happens more often than not, where I would say people have one bad experience. And it may not even be with a healthcare provider. Maybe it was they walked into the hospital and somebody said something they didn't like. Or
it could have been another patient.
It could have been another patient, right? Or it could have been an employee.
Yeah.
Or they called to schedule an appointment and the person had an attitude. Or they got a robocall, didn't like getting that extra message. All these things happen and can influence people's opinion, people's experience, and whether or not they access it in the future. What I would say is give it another chance. Or if you didn't like that experience, find another experience. And, I'll speak from my experience within, WellPoint and Anthem Blue Cross Blue Shield. They will help you find another hospital, another doctor. Whether if you wanted to call somebody, you can have a talk with a representative to navigate to that doctor or a healthcare provider. If you want to use live chat, there's an option to just get on and have a live chat. If you just want to go on at your own leisure online, we have Provider Finder where you can look and see, okay, this provider speaks Spanish, or this provider lives a mile from me.
I saw that.
Or this provider,
I went down the rabbit hole myself.
Yeah.
I was impressed at the calls to action. Dare I even say like preventive measures to get you off. Because it's immediately just thinking about like, oh, well, I'm going to have this problem or this aversion. Yep. It's just like, no, we got you covered.
We got you covered. And I think it's just taking that initial step. Let me take the initial step of trying to learn. Let me take the initial step of just looking into what I have access to. Let me take the initial step to talk to somebody or use a live chat or check a website and get connected. Yeah.
And to that point, like I said, I have coverage. I have TRICARE, and I can go to the Veterans Medical System. Yep. But even having those two, I'm hearing that I could be open to things that could enhance my well-being. Subsidies or extra care. Yep. And I say that because, particularly kind of speaking to other veterans out there, look, I feel your pain. It's hard to say out loud, like to complain about free healthcare.
Yeah.
I'm very grateful for it, but at sometimes, case in point, I'm having a lot of new old issues from my past injury.
Yeah.
Every orthopedic surgeon I had, every orthopedist I had for years was like, we need to redo the left one. And I'm at a point now for the last year, I've been having on again, off again, very extreme pain. Now to the point I can feel the same impingement happening in my femur coming up to where it's like taking time out of my day, cutting workouts short. And so I finally took action, thanks to my wife. See? She's like, you've been talking about complaining for a year. Like, we literally, she has to help me walk sometimes for a year. And I called the VA, and okay, cool. We can see you. And it was about 7 weeks. 7 weeks to get an appointment with a new primary care provider to assess me, to then refer me to orthopedics.
Yep.
I will be lucky if I can see an orthopedist for an issue that has been bothering me for a year. A lot of that's on me. I will be lucky if I can see an orthopedist in the next 3 months.
Yep.
And so now I'm like, I don't want to, nor can I wait that long.
Yep.
And so I need to know what is available to me. I think this is a great case in point for other veterans out there maybe struggling with, you have free health care, but it's going to be weeks, months, where anybody else who already has coverage, you might be able to get something that can help you here and now.
Yes.
Maybe.
Let me give you an example, and I'll pull, I know the listeners weren't privy to this, but we were talking about just in having casual conversation about telehealth. And, some insurers, depending on the insurance that you get, you can have access to zero cost telehealth. So let's say, for example, you're exactly right. Whether it's because of the healthcare workforce shortage in certain areas, and not only geographic areas, but also in certain specialties, whether it be just because, primary care providers are overwhelmed. They have large caseloads of people they're seeing for preventive care, for chronic conditions, et cetera. And so the wait times can just get longer and longer sometimes. And so you may call with an issue that is acute or that you feel is acute and want to be seen immediately for, and probably rightfully so. But they may not just have a slot for you to fit in. And so having the ability to say, okay, great, I do have this primary care provider. It's going to be a while before I get in, but I have an interim solution. I have a healthcare provider I can access virtually on my phone, on my tablet, on my laptop that can hear me, that can help make some recommendations that may be a bridge to my provider, but also they can also send the records to that primary care provider. So these are things that people have access to through their insurer.
Records, that's such an important word when we're looking at healthcare. I think that's something that's probably working against people, is because you don't have the necessary and right type of documentation to maybe get the coverage that you need later on for an injury or something like that. But I mean, that's so incredibly powerful to hear, that you can have access to telehealth to at least document this stuff, so you have proof from a medical professional stating this is what's going on.
Exactly. It's not just you typing in notes on your iPhone about
I got a screenshot of me like
exactly.
No. You got documentation.
You have documentation in a record that can be sent to your healthcare provider that, hey, this is what my physical exam showed. And sometimes even though it's telehealth, there are exam findings that we can see, right, by looking on telehealth, whether it's dermatologic or skin-based or otherwise. But also, what was the history that was elicited from me as a physician talking to you as patient? That's going to be important for your doctor to know, because between seeing that provider via telehealth and seeing your regular doctor, things may change. And so it's important to have that documentation.
And it's going to be in the language that provider knows. It's going to be in the language that the insurance needs in order to give you appropriate coverage.
And to your point, you said, hey, it's going to be 7 weeks or more for me to see that orthopedist. That telehealth provider may see something and say, no, it's more urgent. They can then call or contact that provider and say, I understand you said 7 weeks, but this is why this person needs to get in earlier.
Yeah, you get advocacy.
Yep.
Well, Dr. Gray, this has been incredible.
Absolutely.
As we kind of begin to wind down now, I want to ask you, is there anything that we haven't covered or haven't talked about that you think is still very important for everyone to know about just education, just learning what might be available to them in the healthcare insurance capacity?
I'd say, look, it is Men's Health Month. There is no better month, men, for you to get plugged in, ensuring that you have your ducks in a row as far as health insurance, that you're connected to at least a primary care provider who knows you, with whom you can have a relationship. Ladies, I'm talking to you as well. Help to get the men in your life plugged in and connected as they need to be. Again, it's Men's Health Month. Men, we talked about colon cancer. There's also prostate cancer. There's also heart disease. So many things that we are more likely to die from than women, and earlier than women.
Unnecessarily.
Things that are preventable. But one vehicle to help people to lead healthier lives is getting connected and having access through insurance. And so if people do nothing else from listening to what you and I have been talking to, at least go to myhealthbenefitfinder.com to learn more.
Yeah, absolutely. And again, all this information, Dr. Gray's information and myhealthbenefitfinder.com is going to be all down in the show notes for you guys. And it's been so great to sit here with you and also to partner with you guys on this episode to bring, I cannot think of a more perfect blending of worlds for me to kind of bring this past life of daily healthcare and health promotion into what I'm doing now. And so it's been a gift really to kind of use this platform and to bring this information to my audience in such a unique way.
Incredible.
So thank you.
Incredible. Thank you for having me.
My last question.
Yes.
Let's bring it home. Theme of the show. This, no doubt, is going to help my audience. It's already helping me. I know what I need to look up to help us move forward in our life and our health, to keep living a life ever forward, I say.
Ever forward.
Those two words, what do they mean to you?
Ever forward means progress. It means continual improvement. Ever forward means, to me, walking in purpose. And for me, I believe my purpose is to architect systems and places and platforms where people can optimize their health so that they can walk in the calling and purpose and maximizing that purpose that they have on their life. That's ever forward.
Man, I love that answer. I always say there's never a right or a wrong answer, but they all land so uniquely and different. So thank you.
Thank you.
All right, everybody. That's a wrap for this episode. Thank you so much for tuning in. Again, myhealthbenefitfinder.com. I'm going to have that linked for you in the video description box and the show notes. Just do yourself a favor. Check it out. Spend 5 minutes. I spent literally 30 seconds and was already so far into the website. It's so easy to use. And it just, what I love most about it, it prompts reminders of things like, oh yeah, I should have been looking into this a while ago. Or, oh, I didn't think about that. I never would have if I wasn't prompted. So it's just a great tool and it's free. Go check it out. Get connected. Take care of yourself. And if not for you, do it for future you. Do it for your family or loved ones. Find any other reason other than yourself if you can. All right. If it's not you to move you forward, then do it for someone else.